Hey, it's Leslie Schmidt. I've got my patient here, Coco. He is a neutered male. He's a geriatric. He's over 10 years old, and he's a domestic short hair. He is going to be my patient that I will perform a physical exam on today. I washed my hands before I got Coco out, and I'm just going to talk a little bit about his appearance first. You can tell that he's a geriatric patient just upon looking at him. He is obviously an older cat. He's very sweet. He's very vocal. He does not seem to have a lot of muscle. He's got a lot of muscle atrophy. He's not terribly active, so I would say that's the reasoning for that. So I'd say overall I think his appearance is a little bit poor on the outside. We'll talk about his history a little bit before I talk about his behavior first. He is a very sweet cat, as you can tell. He's very affectionate. He loves the interaction that I'm giving him. As far as his previous medical history, we've had this cat since 2008. He is a hospital cat, so I don't have any history before then. We have a history of his eye being removed. We removed one of his eyes, his left eye here, so that is a major history that we have on him. Other than that, he's been a fairly healthy cat. Our records indicate that he's had some upper respiratory issues, but other than that, he has been a healthy cat. I'm going to go ahead and start with my physical exam. So I'm going to look at him first, and we're going to check out his eyes. So obviously I talked about the fact that he only has one eye, so that would be something amazing to note. He has, in the right eye, there is his remaining eye. I'm just going to take a look and make sure if his pupil is responsive to light. And it is. I noticed that he's got a little bit of hazing in the eye. I see a little bit of haze from a side. That may just be my perception. He does have several little pretty pigmented spots in his iris. Those have been noted by doctors, and those we're not concerned about them being the melanoma that he's had in the past in the other eye. Okay, so we're going to go in and look in Coco's ears now. Coco's just telling us. I know, Bubba. So we're going to look in this ear first. He has both his ears. This tickles, I know. All right, I see a nice clean canal. He said that really itches. Okay, we're going to check this here now. He really likes this. He's just purring. That one. Okay. That one's nice and clean too. He just said that really itches. All right, as far as this ingumentary, obviously his coat, you cannot see from your perception, but it's a very dull, poor coat. He's feeling rather oily, and he does have a little bit of scaling, some flaky skin. And it's just a, dull in appearance, no gloss. It doesn't look like he brings a lot. I'm just going to check him for fleas with a flea comb now. He's really enjoying this. He's really enjoying this, buddy. We apply flea prevention on him every month, so he should not have any fleas. And we're going to check him to make sure we don't see any flea dirt. He said he cannot be enjoying this more. Okay, so the only thing I see is a little bit of flaky skin, and I see, of course, his dull hair. But other than that, I don't see any evidence of any fleas. All right, here I'm going to go ahead and start auscultating him. I'm going to listen to his lungs first, if I can hear over his purring and his meowing. Okay. And I'll also be listening to his upper airway first, and I'll listen right here on the throat. And just hear purring. He does seem to be a little bit congested today, just a little bit of stuffiness. I do not see any nasal or ocular discharge, and I don't note any sneezing or coughing right now. So I'm going to listen to his lungs. And just hear intense purring. Nice on this side now. A lot of purring. Okay, so not hear anything on the lungs. I'm going to go ahead and listen to the heart. We're going to start on the right side and listen to the tricuspid valve. I can stop the purring. I heard it for just a moment and it sounded okay. I'm going to thoroughly listen on the left side. Or listen to the mitral, the atrial, and the pulmonic valves on the left side. getting in between the purrs. His heart rate sounds to be about 160. Yeah. I'm just going to write that down. I'm going to take a look in his mouth and get his capillary refill time and the appearance of his mucous membranes. And I'll also check his teeth too in a second. His mucous membranes are nice and pink. They're a little moist. While I'm in here, I'm going to check his teeth. You like that? I know, buddy. Okay, so a couple things. He's missing some teeth. He does not have his upper left canine. That's gone. He's also missing his lower incisors. And he only has one upper incisor. So he's been in some trouble. I'm going to look at the back teeth. If I can get back here, his little tiny mouth. Okay, his teeth actually look pretty good in the back. There's only some mild to moderate calculus back there. It's not terrible. I didn't see any evidence of any gingivitis. The gums look really good. Okay, so now that I've listened to his heart and his lungs, I'm going to go ahead and try to do a musculoskeletal exam. Here on this, I'm going to be, of course, palpating his joints and just noting his overall muscle condition. As I said, it's kind of poor. He probably does not get out and exercise a lot. So I'm going to try doing a palpation on some of his joints just to see if he shows me any pain. He's a little bit stiff, and that might just be because he's older, or he just doesn't want me doing it. I'm going to palpate his neck a little bit if he'll let me. He's kind of just looking around at everything. Okay. His spine feels fine. I mean, it's prominent again, like I said, but he's not a heavy cat. His legs back here are really atrophy. The back legs are really very poor. Palpate the knees and the hips. He seems to be fine with that. He really is enjoying this. His other leg. He's not giving me any signs of any deep pain. He just said he's kind of a little stiff up here. All right, now onto the digestive system. I'm going to kind of palpate his tummy a little bit. He's got a belly full of food and it's quite round, but I'm going to go ahead and try to palpate his abdomen. I'm just feeling a large belly full of food right now. So, palpating past that is rather difficult. His inguinal region feels fine from what little I can get past this gigantic stomach. I'm going to go in and actually also palpate his lymph nodes. I'll start with here, the mandibular lymph nodes. I don't feel anything abnormal there. He really likes that. I'm going to go on to the prescapular. I don't palpate any enlargement there. I'm going to go on to the axillary area and the lymph nodes there. I don't feel anything there. Come on down to the inguinal region. I don't feel anything there. I'm going to come back here to the popliteal. They're both palpable, but they're not large. All right, mister. We're getting close to the end. Okay, based on our record of him, I know that he is already a neutered male. He was neutered when we got him in 2008, so we already know that his reproductive status is neutered male. Okay, and we talked about the fact that I cannot palpate his bladder because his belly is so big. I'm just feeling one big mass down there. He's not relaxed. He's just got such a full belly. So I'm not able to palpate his bladder, but I will take a look at his penis and everything back here. Looks okay under there. He's just a little dirty on his bottom, so I'll be cleaning this bottom off after we finish it. He's got a little stool back on his bottom. So we already talked about his lymphatic system. I palpated all of his lymph nodes. So I need to get a respiratory rate on him, and it's going to be kind of difficult because he's purring. Yeah. I've got a clock in here to help me with that on the wall over here. So that's 24 on his respirations. His body weight was 9 pounds today. Alright, we just have to get a rectal temperature, and that will be it. Just using a standard rectal thermometer. And I've got some lube here in the drawer. Alright. cooking. I'll go ahead and talk about his external parasites, which he doesn't have any. He has no evidence of any mange, no ticks or fleas, and no evidence of any ear mites or any skin mites. He looks good outside other than his poor, dull, oily, flaky hair coat. Overall, I'd say his body condition score, if we scored him on the scale of 1 to 9, he would be, he has poor muscle tone, but he's a healthy body weight. He doesn't feel too thin, except for the prominence of his backbone, and I think that's a little bit of muscle atrophy. I'd probably scale him probably on like a 4, because he's an ideal body weight. He's not too thin. He's not heavy. Okay, and his overall condition, I'd say it's fair, because he's obviously an older cat, but he still gets around okay. I wouldn't call it terribly poor. If he were having trouble with his mobility, I would say that he was poor, but he's a pretty happy cat, and he does get around as he can for his age. Okay, so his rectal temp today is 100.4. So everything looks good with him, except for the fact that, he's got the missing eye, some missing teeth, and then the dull hair coat and the dirty bottom, which I'll clean up. And that is my physical exam on Coco the cat. Thank you.